Today we are going to discuss a really important topic: 8 warning signs of cancer that you should never brush off. This is something that matters to all of us, either directly or indirectly, and knowing about it is super essential. Cancer is a real tough opponent that can show up when least expected. Whether it's you, someone in your family, or a friend, knowing the warning signs is like getting in there first to fight it. Cancer doesn't pick and choose, and catching it early can actually save lives. In this video, we are diving into 8 important warning signs that could signal the presence of cancer. Often these signs get overlooked as nothing serious, but by learning and spotting these signals, you might just end up saving a life, even your own. Now, what these warning signs are and how to tell them apart from less serious issues. Stay with me and I will walk you through these valuable insights. Throughout this video, I will discuss each warning sign in detail, offering information, statistics, and practical advice on what to do if you notice any of these symptoms. By the end, you will be well equipped to make informed decisions about your health and those you care about. So let's dive right in. Unexpected loss of weight. This is a notable and concerning symptom that could signify an underlying health issue, potentially including cancer. It involves a noticeable reduction in body weight without any deliberate alterations in diet or exercise habits. Weight loss is generally considered significant if a person loses 5% of their body weight within 6 to 12 months without a clear explanation. The increased metabolic demands of malignant cells can lead to weight loss associated with cancer. Specific types of cancer, such as pancreatic, stomach, lung, and esophageal cancers, are frequently linked with substantial weight loss. This weight reduction can manifest even before other cancer symptoms become noticeable. Note that unexplained weight loss could be a potential indicator of cancer, but there are also several non-cancerous conditions that can result in a similar phenomenon. These might include thyroid disorders, diabetes, gastrointestinal issues, and chronic infections. Tiredness. Tiredness is a common and sometimes debilitating symptom that might signal an underlying health concern, including the potential for cancer. It involves an overwhelming and long-lasting feeling of tiredness or lack of energy that goes beyond the usual exhaustion felt after exertion. Unlike normal tiredness, which typically lessens with rest or sleep, fatigue linked to cancer often lingers and may not improve even with adequate restorative measures. Cancer-related fatigue results from various complex factors. One such contributor is the body's reaction to existence of cancer cells. The immune system's attempt to fight the disease, along with the high metabolic needs of rapidly multiplying cancer cells, can create an overall feeling of weakness and exhaustion. Various types of cancer can lead to fatigue, and some, like leukemia, are specially known for causing deep and lasting tiredness. Also, cancers that have spread to the other parts of the body or those affecting vital organs can intensify fatigue due to their broad-reaching effects on the body. It's vital to understand that although fatigue can potentially indicate cancer, several non-cancerous conditions and lifestyle factors may also lead to prolonged fatigue. These may involve chronic illnesses, specific medications, poor sleep quality, stress, and nutritional deficiencies. Due to the potential severity of fatigue as a symptom, especially if it lasts for extended period and significantly affects daily life, consulting a healthcare provider is essential. They can perform a comprehensive evaluation that may involve a detailed medical history, physical examination, blood tests, and potentially imaging studies or biopsies. Changes in the skin. Variation in the skin appearance can indicate underlying health issues, such as possibility of cancer. These alterations may involve new moles appearing or changes in existing moles, which include shift in color, size, shape, or texture. The notable changes in the skin appearance raise concern about their link to skin cancer. Melanoma, basal cell carcinoma, and squamous cell carcinoma, these common forms of skin cancer, typically present noticeable alterations. These changes may involve shifts in pigmentation or irregularities in the border or texture of a mole. When dealing with skin cancer, early detection is crucial. Promptly identifying and addressing skin changes can significantly improve treatment outcomes. Engaging in regular self-examinations and consulting medical professionals for any suspicious skin changes are essential steps in this process. Continuous cough or hoarseness. This condition refers to a lingering cough that persists for weeks or even months without signs of improvement. Hoarseness, in contrast, involves a distinct change in the pitch or quality of the voice, resulting in a rough or husky sound. While chronic hoarseness or coughing may indicate lung cancer, it's vital to note that these symptoms can also be linked to various other types of cancer. For instance, cancer affecting the throat, larynx, or esophagus can cause persistent hoarseness. Moreover, cancers in the lungs or nearby structures can also induce a chronic cough. It's vital to note that a lingering cough or hoarseness does not necessarily point to cancer alone. Other factors such as respiratory infections, allergies, or irritants like smoking can also contribute to these symptoms. As these symptoms could be serious, especially if they persist for an extended period, seeking medical advice is crucial. A healthcare provider can conduct a comprehensive assessment. Shifts in bladder or bowel habits. Alterations in the usual patterns of bowel movements or urination can suggest an underlying health condition, possibly involving cancer. Changes in the bowel habits can involve persistent constipation, infrequent or difficult bowel movements, persistent diarrhea, or frequent loose stools. Detecting blood in the stool, whether visibly or through tests, can also be concerning. These changes may include gastrointestinal problems such as colorectal cancer. Concerning bladder habit changes may include alterations in urinary frequency, changes in urine color or appearance. Blood in the urine or a cloudy look can be significant indicators. These variations could indicate potential urinary tract issues, including bladder cancer. Other non-cancerous factors such as dietary changes, infections, medications, or hormonal fluctuations can also influence these patterns. Seeing a doctor is imperative due to the possible severity of these changes, particularly if they last for a long time. Having trouble swallowing. Difficulty swallowing, medically known as dysphagia, is a concerning symptom that may indicate an underlying health issue, potentially including cancer. It refers to a noticeable and persistent challenge or discomfort when trying to swallow food or liquids. While difficulty swallowing can indeed be a symptom of throat or esophageal cancer, it's important to note that other types of cancer can also lead to this issue. For example, cancers in the neighboring areas or those applying pressures on the esophagus can also cause difficulty in swallowing. The causes of difficulty swallowing can vary. In cases of cancer, a tumor might narrow or block the esophagus, making it hard for food and liquids to pass through. Inflammation or irritation due to the cancer can also contribute to this discomfort. It's essential to note that difficulty swallowing can also arise from non-cancerous conditions. These may involve neurological disorders, esophageal strictures, or certain medications. Pain or discomfort in the abdomen. Abdominal pain or discomfort refers to a feeling of unease or pain in the region between the chest and pelvis, known as the abdomen. This symptom can potentially indicate different types of cancer. One of the cancer types frequently linked with abdominal pain is ovarian cancer. This type of cancer can cause ongoing, vague discomfort or pain in the lower abdomen, often combined with bloating. The intensity of this pain may differ and could either come and go or persist consistently. Typically, the discomfort is felt deep within the pelvis. Pancreatic cancer is another form of cancer that can appear with abdominal pain. Pain related to pancreatic cancer is often described as deep discomfort that typically spreads to the back. It may persist and become more apparent as the cancer progresses. It's essential to note that abdominal pain or discomfort can also arise from non-cancerous conditions. These might include gastrointestinal problems such as irritable bowel syndrome, gastritis, or issues with the gallbladder. Additionally, dietary factors, food intolerances, or infections could also lead to such discomfort. Unusual swelling or lump. An abnormal enlargement or mass that is not usually seen in a particular area of the body is referred to as an unusual swelling or lump. This may be a serious sign of an underlying medical condition such as cancer. Depending on the size and stage of cancer, these swellings or lumps can differ in size, texture, and location. This may or may not be visible on the skin's surface and may be painless or uncomfortable. Usually, lumps or swellings in the context of cancer may result from the growth of aberrant cells. These cells have the potential to develop into a benign or malignant mass or tumor. Metastasis is the term for the ability of cancerous malignant tumors to spread to neighboring tissues or other parts of the body. It is important that non-cancerous conditions like cysts, lipomas, or infections can also cause unusual swellings or lumps. Noticeable enlargements or bumps may also result from these benign growths. These 8 crucial signs of cancer should never be ignored. If you are noticing any of these symptoms, seeking prompt medical attention is essential. Early detection significantly improves the chances of successful cancer treatment. By remaining vigilant and recognizing these signs, you enhance your odds of catching potential issues early, increasing your chances of survival. Waiting for symptoms to worsen is not advisable. If you are worried or have any concerns, don't hesitate to see a doctor without delay. If you found these insights helpful, I would appreciate your support by engaging with this content, liking, subscribing to my channel, and turning on the notifications for regular updates on latest health and nutrition knowledge. Stay tuned for the upcoming videos, and until next time, stay healthy and take care.